What if your child suddenly stops making eye contact or stops speaking words they already learned? These could be early signs of autism. Autism Spectrum Disorder, or ASD, is a neurodevelopmental condition that affects how a child communicates, interacts, and understands others.
Children with autism may have delayed speech, difficulty connecting socially, and may show repetitive behaviors.
They may also become strongly attached to routines or specific objects and feel uncomfortable with sudden changes. The word spectrum means that autism can appear in many different ways and with varying levels of severity. Some children may show mild symptoms, while others may need more support in communication and social interaction.
In some children, development appears normal at first, but between 18 and 24 months, they may lose certain skills.
For example, a child may stop saying words they used before or avoid eye contact.
If parents notice concerns about communication, behavior, or social interaction, early evaluation is very important.
Early diagnosis and early intervention can greatly improve a child's development and quality of life. Recognizing the signs early can change a child's future.